So I think we've heard about how the government has invested centrally into the clinical trials networks, and we've heard about how companies can get investment from the Biomedical Catalyst Fund. I think we're now going to sort of drill down and look at a particular academic health science network, and I think which gets abbreviated to ACHSN or something like that, Academic Health Science Network. And again, Nick here hasn't been very kind to me. He's put an acronym here, which is actually, he's from the EMAHSN, which I guess is the East Midlands variety of the Academic Health Science Networks. So I'm getting used to government acronyms as we speak. And I think Nick is going to do a double act. He's going to start and then his colleague is going to come on second. So it's 5 minutes each, guys, rather than 10 minutes each. But we're really keen to see how you guys are working on the ground to make this all work. Thank you.
Thanks very much, Mark. Right, is the stopwatch going?
I think just push down to...
Which, where am I going? Push down, page down? Right, okay. Right, as Mark says, I'm Nick Pope. I'm actually not from an academic health science network. I'm from BioSpring, which is an independent business startup and business strategy consultancy. But what I've been doing recently is working very closely with the East Midlands Academic Health Science Network, and indeed Carl Edwards, who's my colleague that Mark mentioned, who will take over from me in a moment. And between us, what we're going to do is give you a bit of a whistle-stop tour of what the academic health science networks are in general, and then Carl will talk to you specifically about the East Midlands. So, what are they? Why do you need them? And indeed, how can you engage with them? Well, from the government's point of view, it's all about, I think for all of our point of views actually, it's all about delivering patient benefit, as Mark said. And in this case, putting innovation at the heart of the NHS. Sounds great, doesn't it? So how's that going to happen? Now I'm talking from my personal and a commercial perspective. For me, the thing that got me excited, why I wanted to be involved with this from the beginning when I was asked about it, was really this. It is that potential, really, to improve the patient care through accelerating innovation and adoption and its diffusion within the NHS, and the benefit that that can therefore give to industry and indeed to academia as well. And in particular, in 3 ways. And the main way that I see this is by creating a very simple, single point of access, the way industry and indeed academia can get into the NHS and talk to the people they need to talk to. And indeed, people in the NHS can get ideas out in all areas, be it understanding clinical needs. So you can get to talk to the right clinicians to know exactly what the needs are, to position your products, or in very early stages when you're deciding where to target your technology. To access the clinical research of the expertise of the appropriate form at all stages of the R&D pipeline. And indeed, when it comes to selling and marketing, who are the commissioners you need to talk to in the now multiple clinical commissioning groups, and indeed the trust's budget holders. And actually be able to talk to them in a way that they understand, put your case in the most appropriate manner. And then when it comes to clinical ideas from inside the NHS, how the clinicians can get their ideas out, work with industry in collaboration to get products that can then go back into the NHS and serve those patients with benefits. And one of the problems that I know industry often has is that even though NICE may have recommended a product, it doesn't get adopted. Partly because the clinicians and indeed the budget holders don't understand how they're going to get a benefit from it when a clinical pathway has to change, for example. And so there's a training component to this as well. And then finally, and certainly within the East Midlands example, there's a desire to get clinicians in the industry together to talk more generally, to spark off new ideas, to be able to talk around a single clinical theme. What are the needs in the NHS? What products are in development industry? And between you, come up with new ideas. And Carl will talk about a specific example of this that's already happened. How's this going to happen? Well, very simply, certainly within the East Midlands anyway. It's not by building infrastructure and having lots of people. Rather, it's by acting as introducers, by helping you identify who the right people are, putting you in contact, and actually facilitating the collaborations if that's appropriate. And delivering that through partnerships. Again, by working with existing systems, networks and organizations. As an example, we're here today talking to you, and this is the East Midlands Academic Health Network that Cole comes from, talking with one Nucleus and yourselves. Similarly with Medilinks, working through people like Mark and Oliver have already spoken, and looking at the biological research units, that's a spelling mistake, should be BRUs, that Oliver's mentioned, and I think Cole will mention as well, and the clinical research networks, and many other things. And also having a industry advisory group to guide us through this, or the East Midlands through this. And some of the people that are in this room have been on that panel to start with. So in short, it's a one-stop shop for industry to access the NHS. The problem that we're hoping to solve, I think many of you will know anyway. It's a big, complex organisation. And who do you talk to? How do you know who to talk to? The quote summarises it all there. Simply, we will help you to find and engage with the most appropriate people. The situation has gotten a lot worse with the structural changes. It appears anyway. There's a lot of confusion. This is a fantastic infographic from the King's Fund. That URL is brilliant. It's a video. It builds it all up. Very quickly, I know what the time is. That's the bits that we're interested in. If we pull them out for translational research, we see it there. Over on the right there, the sorts of things that Oliver have been talking about. We've got the higher education establishments, academics, NICE, MHRA, etc. What the academic health networks do is sit in the middle. And from my perspective, they facilitate you to talk to one another, to talk to the NHS, and make a great success. There's only one problem with one-stop shops. There's 15 of them. Does that work? Well, it's a great start. It's better than several hundred trusts or a couple of hundred clinical commissioning groups. So an appeal, please, academic health science networks, talk to one another, work together and realise the potential that this could deliver. So an example of one academic health science network in the East Midlands, the light green bit there. I'll hand over to Cole.
Thanks, Nick. Right, you can see we've got the Midlands and East bridge across the country. I'm speaking in the East Midlands. We've got the contact details from my colleague Karen Livingston, who also participates in the SBRI programme. So there is some joining up in the system already. The thing is, what are the AHSN supposed to do? What are our exam questions? What domains do we have to cover? The adoption and spread of innovation. So in other words, improving patient care by making sure we do the best things the fastest. Adopt the new stuff, get rid of the stuff that doesn't work. But really, what you hear about is the economic growth and wealth creation. So commercialisation of NHS ideas, helping people bring their ideas to market faster. There's a whole set of other things about unmet needs, and actually that's about putting the patient at the centre. So actually, how do we put the patient at the centre of you developing your products faster? Thing is, the academic health science networks aren't overly staffed. There's 3 of us in the network at the moment, and only 2 of us are full-time. So how do you get the best out of the system? We work with Nick, work with Medilink, and so we went through Medilink and went to talk to their companies. What would you like us to do? You know, it's a blank piece of paper. Now, there was the interesting thing that they wanted an industry support function, but there seemed to be a lack of an awareness of what was there already. They were saying, oh, well, we can't get hold of something, we can't get hold of this. And the interesting thing is it's about experimental medicine. Given the fact that what some people talked about this morning about access to tumour tissues, access to patient records, actually these resources already exist. So I work with Medilink. We have the 5 BRUs. We've got 2 biobanks. The biobanks at Leicester work with the AHSC biobanks in cardiovascular medicine. Actually, there's a whole resource that industry can draw on. So we decided we're going to have an experimental medicine event. Now, this is an interesting one. I thought I'd put the agenda up because it is a proper mix of companies, infrastructure. We had Nockery present for us, and the biobanks. Now, given the fact that everybody was given 4 weeks' notice of that meeting, we managed 56 attendees. And the big themes for collaboration were all about access to tissues and the facilities we had. So actually working with patients to develop products. And from just that one event, we've now got a slow-release formulation development project with one of the local contract research organisations, and we're moving on to a regional way of supplying waste surgical tissues for experimentation. And in one kind of small intervention, this is how the AHSNs could start to work together. So what we want to do is actually add value, not duplicate. We don't want to replace ABPI, we don't want to replace Medilink, we need to work with them. And in fact, these are the contact details for my colleagues across the Midlands and East. So Karen Livingston is your local one. If you happen to be across the West Midlands, it's Tony Davis. And it looks like what we're going to try and do is organise ourselves in strips, so north, middle, south. So there'll be only 3 front doors for industry, hopefully. Thanks very much.